Welcome to this new educational video on the health guidelines that must be followed to prevent accidents and infections during the performance of Hajj rituals, as well as understanding the causes that may lead to some injuries. First, sunstroke and heat injuries. Symptoms include excessive sweating, severe headache, nausea and weakness, intense thirst, severe dizziness. If you experience these symptoms, you must immediately cool your body by moving to a shaded or cool place and drinking plenty of cold water. Pilgrims should avoid direct exposure to sunlight during midday hours, drink adequate amounts of water regularly, and not wait until feeling thirsty. Wearing light-colored clothing, hats, and using umbrellas to protect the body from the sun greatly helps in preventing sunstroke. The likelihood of heat-related injuries increases during specific times in Hajj, especially around noon. The most critical times include Arafat. Pilgrims are in open areas during hot hours. Stoning of the Jamarat takes place in crowded areas at midday, increasing the risk of heat injuries. Also, extremely cold beverages should be avoided, as they may cause stomach cramps. If symptoms do not improve within 30 minutes, you must consult a doctor immediately. Second, skin chafing. This is also one of the problems pilgrims may face due to sweating and friction while performing rituals. To prevent fungal infections during Hajj, ensure proper ventilation of skin folds, such as the inner thighs and abdominal area. Keep these areas dry and sweat-free to avoid fungal infections. Use appropriate ointments before any physical activity to improve comfort and prevent friction. Wear comfortable cotton clothing that helps absorb sweat and reduce friction. In case of infection, special ointments for fungal infections can be used after thoroughly washing the affected area with soap and water and maintaining cleanliness. Regarding dehydration, avoid prolonged exposure to the sun and drink water regularly. Eating fruits and vegetables with high water content, such as watermelon and cucumber, helps prevent dehydration. The body may suffer from dehydration without showing clear symptoms, so make sure to spray or pour sufficient water on yourself before going out to perform rituals. It is important to note that drinking small amounts of water at short intervals is more effective than drinking large quantities irregularly. Fourth, falling. Falling is another risk that pilgrims may face in crowded areas. To prevent falling, wear comfortable and suitable footwear. Avoid pushing and shoving in crowded areas. Stay away from slippery surfaces. Fifth, food poisoning. Food poisoning is another risk during Hajj. To avoid it, make sure to wash fruits and vegetables thoroughly, avoid eating unfamiliar or unusual foods, and store food at safe temperatures. If food poisoning occurs, you must go immediately to the nearest health facility. Lastly, contaminated water. Another health risk that pilgrims must be cautious of is contaminated water. Only drink water from trusted sources and avoid drinking water that may be contaminated. If you notice any change in color, smell, or taste of the water, refrain from drinking it. Also, make sure to check the expiration dates of medications. Next video, we are going to learn the safety procedures in Hajj.